For the support of this program. We also want to thank our listeners for their feedback. We want them to know that we want to hear more and more what they are hearing, what they are sensing from this program. The general theme we want to look at is the social and mental effects of drug abuse. We want to put everything into context. You know, what is the effect of drug abuse on family relationships, on family affairs? What is the effect of drug abuse in schools? What is the effect of drug abuse in the workplace? And what is the effect of drug abuse in the society in general?
Mrs. Ndabera, what is a substance-induced disorder?
Oh, thank you so much. You know, this topic is really close to my heart. And thank you, Dr. Chada, for running this program. And you yourself, Tafadzo. It's absolutely amazing. And I think every single one of us in our lives right now, globally, this is a global problem. And we all have got someone who has got in contact with substances. Now, there is nothing wrong with the substances. And I think what is wrong is when we use them in excess in terms of what we are supposed to use them for, right? So, for example, the substances that we are struggling with right now are your everyday cough mixtures. Now, that's a cough mixture that you could be taking to manage a certain condition or a certain disease. But what is happening is we are all taking those things now in the way and the form not as prescribed. And those are the issues that we want to look at today. So, drug-induced conditions is when we are getting conditions that are affecting our health, mentally and physically, due to us taking those drugs or those medications. But what we want to focus on today is when we are misusing them, taking them not for the purpose intended, and the diseases and sicknesses that come thereafter is what we want to talk about today.
All right. But why is it we have people who are actually taking, why are they taking it? They know that this is wrong. Why are they taking excess?
So I think these are complex issues. So I come from a medical background. I'm a trained nurse by profession, and I trained at Parinyatwa, 1996 to 1999. In my profession, ever since then, I've worked in healthcare medical as an entrepreneur for the last 20 years. And so currently, part of the work that we do in our business is actually to support young people, and we do this in the UK. So I want to be clear that this problem, I don't think it's specific to Zimbabwe. It is a global problem. And from the space that where I've seen it right now is that it's complex because we don't know the why, and it would be good for us to interact with those who are taking the substances, because we would also love to learn from them. What are their whys? But I think some of the factors, they're socio-economic factors. And so socio-economic factors are complex because it is not one problem. What drives to someone abusing substances is probably they're yearning for healing. They have got issues one way or the other. These issues could be financial. These issues could be physical. These issues could be social. They're taking it for recreation. So there are so many reasons why they do it. But I think it would be good on the next program to actually have some of these people and interact with them and learn their whys. But what we are saying is we want to highlight today in this program that there are definitely very specific, serious dangers to life and to health that are associated with this misuse. And if we can highlight those, hopefully that will deter those who haven't started. And those who are taking, they probably would be directed to seek for help. And those who are advanced stage and feeling that they are addicted, hopefully they can look for ways and methods of regressing from that journey, because it is a very bad and very dark journey.
100% agree with that. some of them, the complex part comes in when I spoke to some youth some few weeks ago. And I said, do you take drugs because you don't know the effects? And some of them said, we know. So why do you take them? They said there are certain things that we are trying to look for, but you parents are not listening.
Right.
One of them said, we don't want your money, we want you. We love you more than we love your money.
Right.
So that's not a question of ignorance. They're deliberately going there. Some actually said, we are trying to get your attention because you are not paying attention. There are certain things that you are doing. We normally say juvenile delinquency. I've come up with a term called parental delinquency. When you don't do things that the parents or the society expect you to do for your children, that is delinquency. You see, that's a delinquency. You don't spend time with your children, but that's the only way they can learn about life. You don't provide for them as adequately as they should. That is the only way they will know that society is good to me. Okay, for some, they know their parents have got girlfriends and boyfriends. You see, extramarital affairs. The children know it. That is delinquency. And when they do that, they say, you don't do that. But they say, but you are doing the same thing. Don't drink, but you are drinking. Don't smoke, but you are smoking. Why do you prevent us from doing things that you are doing? That is delinquency. The society doesn't expect parents to behave like that. The society expects parents to be models of good behavior. So those are some of the causes, underlying causes of drug abuse.
Coming to you, Mr. Runada. PDT and the fight against drug and substance abuse, is there anything being done to these victims?
Okay, thank you, Tefazwa. Yes, there is something being done. First, we want to acknowledge the work that is being done by our government in terms of providing rehabilitation services to the victims. Government does so in the public health sector, and most of our institutions like Parenyatwa and Imucheni, they deal with these mental health issues on a daily basis. However, we realize that government resources are not finite. They can only do so much. They are also strained because they are dealing with a national population. So what we've done as Advantage Health in partnership with PDT is to come up with a package that then bridges the gap between what government is doing in public and what the private sector is also doing through the private rehabilitation centers. We discovered that the private services become a bit unaffordable to majority of the population. So we are coming in there as Advantage Health Medical Aid Society to create and enhance the access to private rehabilitation services at reasonably affordable premiums. What a person simply does, if they are identified, they subscribe to this particular package which takes care of mental health as part of our wellness programs, and they are paying a monthly premium, and they'll be able to then access services, maybe not 100% of what they're looking for, but it's enough to enable them to walk through the rehabilitation process at a reasonable premium. I'll just put you into context. Most of these centers, they're charging something like $50 per day, and certainly not many people can afford that. So what we are doing is we are running a risk of default, and we all know the cost of default of any medical process. It becomes very costly, and the consequences are then difficult to manage. And in case of mental health and drug and substance abuse, these guys then default and drift back into their old habits, and we end up with a cycle of problems. So we are saying for a modest premium, just pay once a month, then throughout the month you're able to access these services, and you're taken through a program to ensure that it's consistent. Remember, the danger of habit is that once you break the cycle and you don't keep it that way, it takes you back to the old habit. So we then bring in this consistent part in accessing rehabilitation services, and I'm sure this is what also Fungai will talk about in terms of ensuring that these people are monitored and they are kept on that program without breaking their budget. So in a nutshell, basically, we want to create an in-between, a middle of the path between what the government is doing from a cost point of view and what the private sector is doing. So we want to narrow the gap between the two ends through the Advantage Health, mental health package that we have put on the market.
Okay. Well, Doctor, you wanted to add something?
I really...
Okay.
She's the star today.
All right, Mrs. Ndemera, how does the use of drugs and alcohol affect a caring mental health problem that is already there?
Right, so the use of drugs and abuse of alcohol really impacts on the mental health simply because these are issues of the mind. And remember, these are things that impact on your behaviors, and then those behaviors, they then go ahead and impact on your general health. So if you are already someone who is already predisposed, whether via genes or via birth or via association, you're already predisposed to mental health. The minute you start taking anything like alcohol or drugs in excess, it means that that's going to already exacerbate the rate at which you are going to be suffering or you are going to be troubled. So really, the key is don't get involved and don't get started, because that will kick you off and that will tip you to the tipping point. So what we are saying is our mental health is the most important thing that we must look after. You and me and everybody in the room, I'm sure, without your mental health functioning correctly, it limits and it incapacitates you in terms of activity, your daily living, thereby going ahead and then affecting your physical health. And when your physical health is affected, brings us back to the recurring cycle where you don't have affordability for even access to health for your physical health. So it becomes a vicious cycle, and then the impact is more on your mental health because you're becoming stressed and you become worried and you can't manage. And then those behaviors and those stresses are the things that will drive you to coming back to drug abuse and alcohol, because you are looking for that safe space. But those things, rather than giving a safe space, they are actually going to impact you even more or even worse. So what we are saying is we understand that mental health exists, and we understand that we all have got challenges and issues in our lives, but we should not resort to drug abuse or alcohol abuse. Let's resort to other things that are available to support us to a sustainable life that can make us
that are sustainable.
Okay, so let me come in. Dr. Chana. So some of the things that are sustainable. So for example, I'll come back and I'll focus maybe this conversation on our young people. Our young people, some of them, especially during COVID, they were stuck at home. There wasn't much to do. And that brings me back to the point to say, us as a society, ourselves included, families included, what are the things that we can be putting together that can sustain our young people to keep them busy in a positive way? So currently, young people could be engaging in positive recreational activities, go exercise, enroll onto running programs, come up together in your ghetto area and say, guys, let's take care of our health. Let's start to focus on wellness rather than taking drugs. So can we wake up every morning and schedule 2 hours to go for a run? By the time you come back from that run, you are super tired. Your mind is energized, and you can start to do chores around the house. Who is doing the chores around the house? Who is looking after our...
But isn't it easier said than done? Seriously, because most people, they use really waking up, going to take a walk, it's something else.
Right.
I'd rather watch a movie. But let me bring it back to you. So what we have done with our young people, and what we are doing is we are saying to our young people, okay, come, let us lead you by example.
So come and join. Let's have a workout together every morning. So I also get up and I work out with you. So if I can do it, you can do it. So come and join me. So let's use the social spaces that we have. We have got our Facebook, our Instagram, and our Twitter. So we have got those people who are already on those social spaces where our young people are spending more time. So I believe that we can be role models. So if you can come into my social media and follow me, you will notice that I will do that workout every morning. Come and join me and let me challenge you. And then let me walk with you during my day. Come and join me and see what I do when I finish workout. Where do I go? What do I do? And I think someone has to be playing that role model. And I agree with you that it's easier said than done. Hence, us as adults, we must also be playing that role model role. That's
I totally agree with you. There are many things that we are not doing which could prevent kids from reverting to drugs as a result of frustration. Let's go to the COVID-19 period, the lockdowns. Many of the parents, particularly fathers, had never had enough, more than 2 hours a day with their children. They come back 11 p.m., they come back 10 p.m., the children are all asleep. They hardly know them. Now, all of a sudden, you are now forced by the situation to spend 24 hours a day with your children in your home. And they don't even know what game to play with them. You are strangers. Both of you are strangers to each other. What happens is that unnecessary friction takes place in a home. You need to just focus ourselves in the home. Unnecessary friction takes place. Oh, let's do this. The kid might ask, do you know how to do it, Daddy? Oh, you can teach me. How long can we teach you? Before you know it, there is tension. As a result of the closeness, the space that has been created by things that are outside. So, when we have not spent time with our children before, when we now have extended time with them, we don't even know what to do. And there is definitely going to be friction. I used to laugh at one of our senior managers. I saw him during COVID dancing with these children. And I said, did they teach you this dance? And he said, yes. I said, did you do this before COVID? He said, no, I never had time to do that. Now, that is one of the sources. So, violence, which was not known in the home between parents, begins to start. Teenagers, they just get away from violence by walking out. And when they walk out, how do they try to live with the tension that is at home? They go for drugs. He said, so we are part source, we are part cause of the drug abuse. We are not innocent. I want everybody who is listening to hear that. We are not innocent. We are not innocent bystanders. We may, this is what I call a parental delinquency. We may be contributing to this. How then? And the society has actually broken down systems that used to, like community halls, where kids could go, play pool, play this, basketball, tennis, and so forth, volleyball, to release the energy. They are no longer there. Now, sports used to be a thing of the schools. This pandemic is saying, please open up recreational facilities where your children can go. For instance, after school, that's where you've got children. When they come back at 1 o'clock, after that, where do they go? There are no facilities like that. The society should provide facilities like that, where our children can go before you pick them up at 5 o'clock, instead of letting them sit home idle. An idle mind is a very dangerous mind.
If I can just to add on to the discussion about this I think society and parents also need to manage expectations, particularly around our young children. You know, when we were growing up, we knew that for us to eat, we had to go into the fields and work. You have to go into the garden and do something. Basically, we knew that everything that comes into the plate, you have to contribute. There was so much work that we had growing up, whether in the rural areas or anywhere else. But these days, we see a lot of protectionism from some of these parents. I think it feeds into part of the delinquency, parental delinquency is talking about. You need to teach these kids to say, we have got a garden. Irrespective of whether we've got a garden boy, you are going to be waking up this day and water it. So that at a young age, they understand the concept of working, the concept of production. They need to know that anything that comes their way is earned. We don't need to over-promise and over-provide for these little ones at an early age. Otherwise, we are creating a tendency for them to just sit and wait for everything else to happen. You find that a 25-year-old is abusing drugs, and possibly the mother or the father is actually struggling to continue feeding him at 25, to feed even that drug situation that he's having, because he's never been taught how to work. So we need to make sure that we manage that expectation and do away with this protectionist kind of approach to our kids. They're not any special to when we were kids. We were also once kids. And that tough raising created a lot of the tough people that we have got around. So I think it's very, very important for society and parents to realize that, of course, there's a thin line between abuse and disciplining and stuff like that. But we all know when it now becomes abuse. And we all know when it's discipline. It's not for the child to say, I'm being abused. I think people who observe can always tell that this is abuse, this is discipline. So we need to ensure that discipline is entrenched into these kids as they are growing up. Look at how these guys at the bridges even answer you when you stop by and try to talk to them. Look, to them, they don't have that respect because they were being protected as they were growing up. Now everywhere at home they're being protected. At school they're being protected. No beating up, no manual labor, no what. So they end up with this special feeling that they are special. They can do anything. They can get away with anything. And I think we need to start moving away from that.
Exactly. That's what I also want. Okay. So, go ahead. I wanted to say that maybe we should also entrench the willpower, the self-motivation also from these teens. That when they do something wrong, like what you say, they need to be disciplined. We know we have this tendency that parents will say, no, or maybe they are told by their neighbor that your child was doing this and that, and then they're like, no, I know my child would never do that. But probably he or she was actually doing that. But then parents, we have this protective mannerism that we have. Okay, you wanted to say something?
I also want to come in and say that we have been running some apprentice programs for young people in our organization where we are saying young people come and we give an opportunity to learn. Our offices are based at number 4 Phillips Avenue, where we are embracing young people and giving them things to do. But the biggest challenge that I have seen is those behaviors that we are talking about. And so when we are bringing young people into the workplace, remember we have got an office start time, we have got a break time, we have got a finish time, and we have got a certain corporate culture that we expect young people to adhere to. And the biggest challenges that we faced with these sort of behaviors is that young people are struggling to be integrated into the workplace, because they have got no discipline of the workplace expectation. So some of them will go into the workplace, but they will not thrive. Hence, because they are not mentally tough, they are going to revert to the easygoing. Mama, they are mistreating me at work. Mommy will say, it's okay, my baby, stay at home. It's cool, right? And so those are some of the complex issues I was saying. It is quite a complex subject, because some of the issues that the young people, they don't have the tenacity or the skin for the adult life that they have been brought into. Suddenly you have to find a job and you have to be in a workplace. But the workplace manager is saying, I need you here at 8 o'clock. And the young person is saying, well, I wake up at 8. So they're not coping even in the workplace. So those are some of the examples that I could also give and put forward on the table.
In summary, she is saying, we have not taught our children how to live. They have a life, but we haven't taught them how to manage that life. For instance, is it not abuse when a child says, Daddy, I would like to go for a weekend with my friends. Instead of asking, who is your friend? Where are you going? What are you going to be doing there? You said, how much do you need? Oh, $50 will do. Okay. He goes. You don't even know. Half of that is going to drugs. Half of that is going to booze. You don't even know. So that is part of our irresponsibility. That is part of delinquency that I'm talking about. You know, we are culprits. One of the things that have led us to be laissez-faire, to be permissive, is that we look back where we came from, Mr. Runang. Oh, we used to wake up at 4 a.m. to go and plow the fields before you go to school. 4 a.m. By 6, you're finished, went wash, go to school, but still pass. These kids, they wake up at 8. They haven't even done their homework. They didn't do their homework last night. And we tolerate that. So that's why I'm saying we are becoming part of the problem. And the kids, when a kid is now a teenager, and the behavior, our attitudes towards what they do even when they are young is not corrected. At the teenage level, parenting becomes a war of wills between you and your teenage boy or girl. You are now afraid. Where were you? You are now afraid of those questions. Where were you when I was growing up? You never told me don't do this, don't do this. Now you are telling me don't do this. Where were you? Now, so the parents are now afraid to intervene because they know they made mistakes. Right from the beginning, they never told this boy how to grow a lettuce, cabbage, or even to have a bed in the garden, to water the garden, to cut the grass. Well, there is a gardener. The girl doesn't even know how to make tea. Well, there is Sisi, who makes all those tea. She doesn't even know how to cook meat. There is Sisi. All she knows is to eat. Now, she is now alone with her Mr. Right. Mr. Right expects the tea to be made. Mr. Right expects her to cook food. She doesn't know. Before you know it, there is now friction. Within 1.5 years, they have divorced. After a beautiful wedding. Where are we going? It's reverting back to us. It's reverting back to us. We let them down. And that is also leading. When you are frustrated, they get to take drugs to remove frustration. They think they are solving a problem, and when they don't know that they are putting a problem on a problem, and that problem will never be solved.
5 minutes before the news at 11 o'clock. Mr. Runganga, your closing remarks, and we go to Ms.
Okay, mine was just to collaborate. So one of the key issues, particularly with teenagers, these youngsters, if we can, let's try to make an effort to know and associate with their friends. You know, if you're a parent, I think it's right to always demand to meet the friends of your children, spend time with them, and also get to know their parents, so that you're in a full circle of knowledge to say, this is what my child is being exposed to. It's very, very key. Like Dr. Hida was saying, a child will just say, I'm going out for this and that. You don't even know where, with who, doing what. So let's have this, and now we're giving kids cars at a tender age. Go and drop them at the friend's house, greet the parents, talk to them to say, these guys are saying they want to do A, B, C, D, E. And then naturally a child becomes conscious that I'm being monitored here. And lastly, we've got different beliefs. But I think the church plays a big role. It's always good to bring these guys face to face with church, face-to-face with religious education. It may not be the ultimate solution, but it helps in reducing and enhancing the way that they think. Thank you.
All right. Thank you so much.
Thank you so much, guys. It was an amazing program. We need a whole day for this. My closing remarks are that there is support available. We've spoken a lot about the parents, and please excuse us parents. It's not that we wanted to bash, but this was a conversation. There is support available for the parents and for the children. So let's reach out to the support that is available. The government is offering the services. There was an article last week in the news wherein the government is saying go and seek help. Currently, you can go to Parinyatwa Hospital. You can go to Parinyatwa Hospital A&E, because A&E we always think it's for physical health, but also for mental health. If you've got someone, a loved one, please attend the hospitals. And in Blawayo, it is all the main city hospitals. They do offer these services. So please, if we've got those we love, let's take them to seek for help. And then there is also the private health care available. Please do reach out to Mr. Ronganga, who has promised what packages they have. With CheckUp Health, we are also offering free monitor health at home services. I have realized that with our research here in Zimbabwe, currently our biggest killer diseases are our hypertension and diabetes, because the parents are struggling and they are so stressed. And we are offering monitor health at home. Don't suffer, don't die from diabetes, don't die from high blood pressure. CheckUp Health is available to offer you free access to the nurses and to the doctors for them to help you improve your health, and you can do it from anywhere. From your home. It is available on an app that is available on iOS and on Android. You can go to our website www.checkuphealth.co.uk, and our contact center in Zimbabwe is in Ruwa. So look at our website, look at our social media, Facebook and Instagram, look for CheckUp Health, and please seek for help so that you can be supported and you don't have to die. Thank you so much.
Well, I enjoyed the program. All I can say is that social effects of drug abuse are non-discriminatory. They are affecting family. Families are breaking down as a result of that. They affect school life. Kids are actually getting out of school, failing when they are really brainy, but they are failing as a result of abuse. At workplace, we have industrial accidents that actually are reducing companies to zero. Is there a system that can bring this person to normalcy? Some doctors have said for some disease, for some mental health, you can't. But we don't know which. So what is the remedy? Stop it. Stop starting drug abuse. Just stop it. You will have a better life without drugs. And that is the solution to the problem.
All right. Well, thank you so much, leader and gentlemen, for coming through to the program Classic 263. All right. You're listening to the Zimbabwe Broadcasting Corporation Classic 263 Radio. It's 11 o'clock and it's time for the news.